All right, so we're up to 53 attendees right now. Rita Hubbard, good evening to you, Miss Rita. Latasha Swain, hello. Sherry Shepard, your video is not on, so we cannot see you, but we can actually see your chat. So if you guys have any questions for the panelists tonight, just open up your chat box and feel free to just type it into the panelist for any of the segments that we're going through. You can address that panelist specifically, or you can send a message to all panelists. Tangi Franks, good evening to you. Hello, Pam. All right, up to 54 attendees now. All right, and we are live across Facebook and YouTube as well. So we're going to go ahead and get it underway, Dr. Baumberger, if you're okay with that.
I'm ready.
All righty. Thank you, ladies and gentlemen, for showing up tonight for our virtual holiday spa party. Thank you for attending. We're really excited to have everyone here. We got a lot of great content to share with you, subject matter experts from everything that we provide our clients here at Well Life Medical Spa. And to kick things off tonight, I'm going to turn it over to Dr. Catherine Baumberger, our medical director and owner of Well Life Medical Spa. Hi, Dr. Baumberger.
Hey, how are you? Good evening, everyone. I'm Dr. Catherine Baumberger. I am the owner and medical director of Well Life Medical Spa. This year, 2020, has presented new challenges to find that special gift for someone that is personal and meaningful. Due to the circumstances surrounding the presence of the COVID-19 pandemic, we would like to try and make some of your gift giving easier by relieving some of your stress by getting your gift to you easier and to be guaranteed on time. That's why we're thrilled that you chose to join our virtual holiday party. I'd like to take this opportunity to show you around our facility and explain some of the procedures and introduce you to a variety of skincare products that we offer, which would make great holiday gifts for this season. As a medical office, we maintain strict precautions to guarantee your safety in all of our procedures. We offer a variety of services, most of which are going to be demonstrated during this video tonight. And if you're unsure what the perfect gift would be to give someone or to give yourself, one for them, two for you, we are available to offer free consultations online or in person at your convenience in the safety and convenience of a meticulously clean medical office, and your protection is our priority. We also have gift certificates available in various amounts if you just can't decide at all. Again, we thank you all for joining us tonight, and let's go ahead and kick off this holiday celebration and get this party started.
All right. Thank you, Dr. Baumberger. And we're excited to go ahead and right off the bat, we have Mr. Daryl Yosway. And Daryl, I may have mispronounced your name. Did I get it right this time?
You got it right, Mike.
All right. Good deal. Mr. Daryl Yosway is our subject matter expert from Abaji Skincare Products. Daryl and I actually went through the other day and kind of looked at what all he was going to present, and it turned into like an hour-long conversation with Daryl. Abaji just does so many things, and there's so many things that they provide us here at Well Life Medical Spa as far as resources and training and product. So Daryl, I'm going to turn it over to you. Kick it away, my friend.
Thank you, Mike. Thank you, Dr. Baumberger and Jenna and everybody.
Joining us.
Yeah, absolutely. I want to say, first of all, we are thrilled to be able to partner with you guys, and we know that you guys provide amazing services to your patient base, and we want to be part of that. And so a little bit about Abaji, just for those of you who are not as familiar with our products. We have been around for 33 years, and we are the leading physician dispensed skincare brand in North America. So when we talk about physician dispensed skincare, I think it's an important topic that we delineate what that means when we talk about that versus what you might find over the counter, what you might see as you're walking through that cosmetic aisle or you're shopping in a store like Sephora or even online. physician dispensed skincare is elevated skincare. So what we do as a brand is we change skin at the cellular level. So we only partner with physicians. So you can find us in med spas and plastic surgery offices and dermatologists. And we really do take pride in the fact that all of our products undergo clinical studies. We want to make sure that they are safe and efficacious. We test our products on all skin tones, which is very important. So skin tone, when we talk about skin tone, we refer to the Fitzpatrick scale. So someone with a Fitzpatrick 1 would be someone that has a very fair complexion versus a Fitzpatrick 6, which would be a very dark, deep complexion. We test our products on all of those. So we want to make sure that patients and clients feel confident that we have a product that can address their needs. We address everything from anti-aging to hyperpigmentation and melasma. And we do that through all of the trials and all of the tests that we run on our products on a regular basis. We don't launch any new products without having had a clinical study to back them up. So if you guys have any questions, or Mike or anybody other panelists have questions specifically, happy to talk to you about what we can do to help address skin issues. I mean, one of the biggest things that we run across, of course, is the ever present lines and wrinkles and uneven texture. And so one of the products that we really are proud of is our tretinoin product, which is a pure vitamin A, or otherwise known as a retinoid. I always say it's my one-hit wonder. So if you're thinking about a gift idea, anyone over the age of 30 needs to have a good retinoid, a good retinoic acid. It's going to help promote cellular turnover. It's going to help with clarifying the pores, making them appear smaller. It's going to help with the skin tone and the texture. And it's just an amazing product that's used once a day at night. So I'll open it up, throw it back to you, Mike, to see if anybody's got any questions in the chat box, or anybody else has anything they would like me to address specifically with skincare.
Yeah, Daryl, we do have a few questions coming in. However, I wanted to put up the visual that you showed me the other day with the skin inclusion, and because we were talking about, is Obagi products right for everybody, right? And
Right.
I really wanted to be able to show folks exactly what we were looking at the other day, because I was really amazed by it. I had no idea that Abaji's done so much work in promoting skin inclusion, skincare products for everyone. So let's pull this up real quick, and this is something that I found extremely interesting, because and if you could talk to the different skin types that we're seeing on the screen, Daryl, that would really help us understand how Obagi tailors itself to every skin type.
Let's see. I'm having a little technical difficulty here getting back with you. Do you have it pulled up? I'm not seeing.
Yeah, I do. I've got the skin inclusion graph pulled up.
Let's see. For some reason, I'm not seeing it.
I'm not seeing it either, Mike.
Okay.
I might have it on my, let me look and see. I think I've got it on my desktop.
Okay.
Let me go here. Share screen.
There we go. Perfect.
So let's look here. This one might not be the one that we have the Fitzpatrick's, Mike. I'm not sure which one, where we were showing. Oh, that was on the catalog. We might need to go back to that. Do you have the catalog, the product catalog that we have?
You're muted. We can't hear you.
Yeah, that's what I was trying to show everyone on the screen, was the skin inclusion to Fitzpatrick.
Yeah, that's the one that I've got to pull up on my other slide.
Okay.
Let's see. Are you still seeing my screen?
Yes, we are. Yes. You have it on your,
I do.
okay, cool.
So this can everyone see my screen? And you can hear me? Okay, good.
Yep, we got you.
So let's take a look at what we talk about when we talk about Fitzpatrick's. So Fitzpatrick is sort of the technical term, but basically it's really describing your skin type. So when we look at my screen, you'll see type 1. So type 1 is considered ivory. That's someone that's very, very fair.
Yeah, we're
They
still
always
seeing the other
freckle.
deck. Yeah, we still got the other deck, the 3 C's up there.
Oh, you do?
Yeah, yeah.
Let's see. Let's see. Well, let's see. How about now?
It's still in the 3 Cs.
Cheryl, you might try unsharing and then resharing your screen, selecting the new document.
Okay. Is that it? You see it?
It's still pulling up.
Really?
Here we go.
There we go.
You got it?
Yes.
Perfect. Sorry about that, guys. So type 1, we're talking about ivory. And then we move into type 2, which is fair or pale. Type 3, fair to beige. Then type 4, olive or light brown. Type 5, dark brown. And then finally type 6, which is deeply pigmented. So when you look at this, what we really are saying in terms of as a brand, as a product line, when we do our clinical studies, we study equally across all 6 Fitzpatricks. So when someone says, you know, I have an issue with acne or hyperpigmentation, or I want something for anti-aging, we assure them that the products that you are going to use have been tested on your particular skin type. So if you're a fair type 1, where you burn very easily and you freckle, versus someone who is a type 5 who rarely freckles and almost always tans, the same products that are good for type 1 are going to be effective for type 5, because we test equally across them. A lot of companies spend a lot of energy and time on the 1s, 2s, and 3s, and those tend to be an easier skin tone to address. The 4s, 5s, and 6s, particularly when we talk about hyperpigmentation, those can be much more difficult. So we are really happy to be able to provide a really good, broad variety of products. And that's really what the idea behind Skin Collusion is. So Skin Collusion is our partnership with Priyanka Chopra Jonas. I'm sure you all know her. She partnered with us a little over a year ago, and she has been an Obagi fan and an Obagi user for many, many years. And so she decided to join us in this journey of speaking to diversity in skincare. She wanted to make sure that skin tones were represented evenly and fairly, and we as a brand wanted the same thing. So it made perfect sense for us to combine our resources, and it's been an amazing journey with her, and she's been able to really show how diverse our brand is across all products.
You know, it's pretty awesome, Daryl, to see how many different skin types Obagi can take care of. So no matter what type of skin tone or texture, you guys have an answer.
Absolutely.
And this is some of the training and expertise that Obagi provides our estheticians here at Well Life Medical Spa. Correct, Daryl?
Correct. Absolutely. They're all trained thoroughly on first conducting a good consultation. So at Obagi, we really teach the 3 C's, and you can even see that on the screen where we talk about condition. So condition is really what that clinician, what that esthetician is seeing when she looks at a patient and she looks at a client. Are we seeing acne? Are we seeing age spots? Are we seeing hyperpigmentation, fine lines and wrinkles? Once that condition has been really determined, we move on to the second C, which is concern. The concern is, what does that patient, what does that client see when they look at their skin? Are we aligned in what we see? Once that alignment comes together, and this is where the beauty of doing a really good consultation and what Well Life does so expertly, is to align those two together, that condition and that concern, and finally come up with a commitment. The commitment is, what is that patient, what is that client willing to do to address the concerns and the conditions so that they get an amazing outcome. When all three of those C's align, that's when you get beautiful skin. And that's really what Well Life is all about, and what we're about in terms of who we partner with.
Yeah, that's awesome, Daryl. And we've got a few questions. Lana Smith is asking, are your products based of essential oils or are they synthetic?
So great question. Some of the oils that we use are things like hibiscus and Abyssinian. The oils that we use are all natural oils. We're not using any type of synthetics. We don't, as a general rule, have a lot of oil-based products. So that's just something that, just in general, we're not heavily laden with oils. And when we do, they're going to be naturally occurring.
And also, Daryl, we had talked about one of the products that you guys carry, because I had a question the other day about when we were talking about Obagi, about everybody's concern over acne or maskne. You know, everybody's wearing masks now, right?
Oh, yeah.
And when we were talking about that, you basically showed me all about the derma system that looks to be pretty awesome. I mean, can you talk to us a little bit about that?
Sure. So when it comes to the whole mask acne, which is rampant right now, I know I suffer from it when I go to the gym and do cardio and have that mask on. You know, what's happening, just so that we all understand what's happening with our skin, is as a result of having that mask, we are really suffocating our skin, and it's not allowed to really get to breathe. So I think I lost you. Am I still here with you?
Yeah, you're still with us. I'm actually was moving over to the
Getting to the Cleansiderm. Okay,
Yeah.
good. So what we're doing is we're kind of not allowing our skin to breathe, and as a result, we're having bacteria. That bacteria that clogs the pores. It goes down into the follicle, and as a result, we get clogged pores, and we end up with acne. Even as adults who normally would maybe not suffer from acne, due to this kind of extended having to wear these masks all day long and be active when we sweat, this is what's happening. So the Cleansiderm system is specifically designed to address that. The active ingredients, we're using salicylic acid, which is an amazing acid for actually destroying bacteria. We know that bacteria thrives in a non-oxygenated environment. And so what this salicylic does is it helps drop a bomb of oxygen basically onto that clogged follicle and destroy the bacteria on once it comes in contact with it. The Cleansiderm system has three components. It has a foaming cleanser. It has a pore therapy, which is a great toner. It's a product that you can use to both balance your skin tone and balance your pH of your skin, and also destroy surface bacteria. And then it has a spot treatment, which is benzoyl peroxide, 5%. And it is a solubilized benzoyl peroxide, which we own the patent on that delivery system, which means that when you put that benzoyl peroxide on the surface of your skin, on that acne, it's going to penetrate deep, destroy that bacteria, and not spend a lot of time on the surface of the skin drying it out. So I think that the Cleansiderm, for those of us that are suffering from this, great solution to that mask issue that we're all having.
Yeah, I definitely, I was pretty impressed with that system. And I think that that's a big concern for a lot of people now, because they're wearing their mask all the time and they're getting the acne, the breakouts. So I know we had a couple more questions here from folks. Let's pull them up really quick.
Sure.
Cheryl, real quick. What if you have the, the acne from the mask, but you also have very sensitive skin that dries out very easily? Is Cleansiderm the right system for you?
That is a great question. And It is the right system. And the reason is that every product in the Cleansiderm system has been pH balanced so that it doesn't upset the natural barrier of the skin and it doesn't pull moisture from the skin. So it's not going to dry the skin out. The biggest culprit of drying skin out in terms of an acne system is the dreaded benzoyl peroxide. And benzoyl peroxide as an ingredient in and of itself is pretty standard across the board. They're all pretty much the same. We use 5%. It's the delivery system that's different for us. So other benzoyl peroxide products spend a lot of time on the surface of the skin. When they're on the surface of the skin, they're drying it out. Ours, on the other hand, penetrates and goes deep to where the P. acne lives and destroys that bacteria. So it's not really sitting on the surface drying the skin out.
Thank you.
You're welcome.
So we got a question from Susan Kitchens. Susan wants to know if you have products for rosacea skincare.
We do have products for rosacea. We don't position them specifically as rosacea products. We have products that are better suited for patients who suffer from rosacea. Rosacea is an issue that we really we want to be clear that it's something that needs to be addressed by a dermatologist, but we do have products that will not aggravate and that will actually help improve the symptoms of rosacea. Gentle Cleanser is one of those. It's a very gentle, mild cleansing product. We have a 10% vitamin C product that's really good for rosacea patients because it's a low percentage of vitamin C. It's going to help with inflammation, antioxidants. It's going to help the skin defend itself. We have an amazing product by Susan Obagi. Susan Obagi is our medical director. She is an active cosmetic surgeon and dermatologist based in Pittsburgh, and she has formulated her own line of products that are appropriate for very sensitive skin. And we have a product in that line called Intensive Daily Repair, IDR. It's a great product because it helps slough off the dead skin cells so that the new cells can come to the surface, but it also provides hydration and it's excellent for rosacea. So what I would say to the rosacea patient is really come in and have a consultation with, at Well Life and sit down with someone, with an esthetician, and talk about their challenges, and then they can put together a customized routine to address their concerns.
Yes, definitely great advice, Daryl. And I've got just a couple more questions here. Teresa wants to know, what about deep wrinkles? Do you guys have a product for that?
Deep wrinkles. Oh, that's my favorite.
I think that might be another segment, Dr. Baumberger.
I love talking about deep wrinkles. So, the best solution to deep wrinkles, I'm going to throw it back to the Well Life. And, we all our neurotoxins, that's going to be the way to go with your wrinkles. So your neurotoxins are going to help paralyze that muscle and it's going to help smooth out those lines. So what I would say to someone who has deep wrinkles is we need to address two types of wrinkles. We have our active and we have our static. Active wrinkles are the ones that are from doing this and scowling, and my forehead's not going to move, you guys, because I've just got my my Dysport. So I like to call it, I'm Nicole Kidman right now.
Not going to move either, Daryl.
Yeah, no expression here because it's all dead. But so when we talk about wrinkles, we're talking about active wrinkles that the neurotoxin can help address, right, by paralyzing that underlying muscle and causing it to relax. And then we have static. Those are the fine lines around the eyes. They can be some of the lines we see, the smiling, where we have these troughs right here. Those can be addressed with products. One of them is our tretinoin. Again, going back to tretinoin, vitamin A, it's amazing because it's going to help cellular turnover. It's going to help fine lines and wrinkles. Another product that they could use would be our Hydrate Lux. Hydrate Lux is great for dry skin, but it also has 2 biomimetic peptides that work in conjunction with your body's repair. So at night, when we're doing all our repair work, those biomimetic peptides help to address lines and wrinkles. So I would say neurotoxins combined with great skincare, that's your best bet when it comes to addressing deep wrinkles.
Yeah, great question. And a lot of great questions here from our audience tonight. And I think that, anybody that really wants to learn more about the Obagi products and want to learn more about their skincare, you go ahead and call us up tonight. We've got live operators here at the office taking your phone calls to schedule those free consultations. And we can also do a consultation via Zoom as well. We can do a virtual consult, or we can do a face-to-face consult here at Well Life. And Daryl has actually given us some things for a giveaway tonight. And Daryl, what were we going to give away in this segment?
So I think that if I'm not mistaken, we've got a good cleanser and toner that we're going to give away. We have an eye cream. We have a great overall moisturizer called Hydrate. So the products that we're going to give away tonight, I want to make sure everyone understands they're going to be appropriate for anyone. So we really wanted to make this something where anyone could benefit from it versus something very specific that would address an issue like, say, hyperpigmentation. Well Life has got it all. So you guys need anything, they can get it for you. But our giveaways are going to be great for any skin type.
Yeah, so we were talking about this in our meeting the other day. What's a good product that we can do here at the end of the segment as a giveaway that would be good for anyone?
Hydrate.
Hydrate?
Yeah.
Amber is actually putting together our names right now and is going to draw one shortly.
Awesome.
Yeah.
That's what she just came in to interrupt me for. Hold on, here she comes. You've got a name? Amber has a name.
All right, and our winner of the Hydrate is?
Our winner of the Hydrate is Tangi Franks.
Tangi, congratulations. Awesome.
Congrats.
All right, Tangi, you can come by the office next week, give us a call. We'll be more than happy to bring that down to you, or come in for a free consultation and we can show you how Obagi can be really great for all your skincare needs. Daryl, thank you so much for joining us tonight. We really do appreciate your support. And Dr. Bomberger, anything you want to
add? No, I just appreciate Daryl's being here, and he's always entertaining, and I always enjoy spending time with you, Daryl.
Thank you, Dr. Bomberger. I feel the same way about you guys. I can't wait to see you in person.
Can't wait to see you.
No one else can do a Zoom presentation from his ride, that's for sure.
Yeah, that's me.
I don't know how you got such great lighting in a car.
Exactly.
It's the screen. It's the screen from my computer.
There we go.
Yep.
All right. Congratulations, Tangi. Thank you so much, Daryl. And we're going to go ahead and move into our next segment. So Lisa Sternberg is with us tonight. Lisa is our cool sculpting subject matter expert who provides us with all of our training, our resources, everything that we need to provide a great experience for our cool sculpting clients. Good evening, Lisa.
Hi, good evening, everyone. Mike, I think, I would love to have you as my hype man for every single presentation. I do. You do an incredible job. Before I get into cool sculpting, I actually did want to share a little bit of my experience on the Obagi products, because it was about 4 years ago when I was suffering from really bad melasma. I tried just about everything. I had a lot of pigmentation, and I can go close to the camera, down the middle of my forehead, and then a lot of pigmentation on my cheeks. And it was one of the Obagi systems with the tretinoin that absolutely saved my skin. So, as passionate as I am about cool sculpting, I'm nearly as passionate about skincare. So it's wonderful to hear about Daryl talking about the products that you guys have at Well Life, because it's there really is a solution for everyone with the Obagi. So with that, I will start to share my screen. And thank you everyone for joining. Let me just make sure I get the technology moving.
Definitely agree with you, Lisa, that the hydroquinone, the skin care product Obagi is wonderful for the discoloration that occurs after you have a child, and it's just been, I have the personal experience as well, and it's a wonderful product.
Yeah, I mean, the most embarrassing part for me is I got this pigmentation like lip mustache that was so embarrassing. I had no idea how to treat it. And it was a kind doctor similar to yourself that said, Lisa, we can get rid of that with Obagi. And I was like, great, please. Once again, thank you everyone for joining. in regards to cool sculpting, I know that several of you are on here and you've very likely heard about cool sculpting, but you're here to find out more. And typically people have a couple questions about cool sculpting. Usually the first question might be, what is cool sculpting? Second question might be, how does cool sculpting work? Third, usually what kind of results can we expect? And then number 4, how do I know that cool sculpting is right for me? So I'm here to answer some of those questions that you have, and we have set aside a Q&A as well for cool sculpting. But before I jump into the presentation, I wanted to share a little bit about my experience with cool sculpting. So I've been with cool sculpting for over 5 years now. I have worked for cool sculpting in over 40 countries now. And it's incredible to represent a product that so many people have experienced and have really seen life-changing results. The way I found cool sculpting was actually typing into Google non-invasive liposuction arms, because my arms were the #1 area I was most concerned with. And that year I was going to be in 3 different weddings. So I found a practice very near my house who was having an in-person event, as it was appropriate at the time. And I turned up for the event and I had a wonderful consultation there. And I went home to my husband at the time and I said, honey, I really would like to treat my arms. He says, okay, you can do it, but you have to stop shopping for 6 months. And I'll always remember that moment, because for me, as soon as I had my arms treated, my results were so incredible. I actually called my girlfriends in the US and asked them if it was, you know, going to be right for me to come to the US and have the rest of my body treated. And they did even better. They got me a job in London. So here I am 5 years later, over the top passionate about our product and so excited to be working with Dr. Bomber and the Well Life team. Because something that's really special about them is they're not only combining the best technology in body contouring to get patients great results, but they're also looking at things like wellness, things like hormones, balancing weight as well. So there's a whole slew of solutions that Well Life Med Spa really provides. And it's really great that cool sculpting is one of those solutions. So if there aren't any questions, I will kind of start the presentation.
Thank you very much, Lisa.
So cool sculpting is the only FDA cleared technology that uses cold to kill fat cells. It's actually been available in the US for over 10 years, and it's the #1 non-surgical fat reduction treatment across the globe. We've now actually done over 8 million cool sculpting treatments worldwide. I know the slide says 7 million, but sometimes it takes a little bit longer for us to update our slides from a marketing perspective. So we're now at over 8 million treatments. It's also available in over 80 countries and has been studied in over 100 published and peer-reviewed publications. Doctors like Catherine Bonberger are incredibly selective when they look at products to bring in for their patients. And so we know that cool sculpting is well researched and it's safe and effective. There are 9 different areas that we treat with the cool sculpting treatment. I've actually had most of those areas treated myself. So if anyone wants to know what it's like having those areas treated, I'm happy to answer them. We treat the jawline, or just below underneath the chin. We treat the arms, the abdomen, the love handles, the back fat, the bra fat as well. So this little piece here, the banana roll, which is that cute little area underneath the buttock, the inner and outer thigh, and then also the area above the knee. So 9 different areas that we can treat and sculpt with cool sculpting safely and effectively. It's quite fun how they started to invent cool sculpting. It was invented by what we call the modern godfathers of dermatology, Dr. Rox Anderson and Dieter Manstein. And at the time in the 90s, there were only ways to either physically take out fat cells like liposuction, or using heat to heat them up to the point that they, explode and die. These doctors wanted to find an easier, safer, and more comfortable way to treat fat cells and to get rid of them. And they found one study from the 1970s, which focused on small children who were showing up at doctors' offices with red, swollen lesions on their cheeks. Several days to weeks later, these children were then getting indentations in the cheek fat area. And what these doctors found in this case study was that these children were sucking on popsicles, and it was the extended exposure to cold that was causing the fat cells in their cheeks to die. They then found a second study from the 1980s called equestrian paniculitis, where these women were actually reporting to the doctor with these large swollen lesions on their outer thighs. And what was happening here is these women were riding with very tight jodhpurs on their legs in the middle of winter in the Virginia mountains. And it was the constant contact to cold and limited blood flow from the jodhpurs that was causing these indentations in their outer thigh. So I like to joke, you have a few ways that you can kill fat cells with cold. You could suck on popsicles all day long. You could go out horseback riding in the North Georgia mountains or in the Appalachians in the wintertime, or you can relax at Welllife and get your cool sculpting while taking a nap, reading a book, or even working on your Zoom calls. What we do with the cool sculpting treatment is we use cold to selectively target those fat cells. So how does the cool sculpting procedure work? What we do is we identify and target those non-responsive diet and exercise resistant pockets of fat. Now, we don't see you on your screen, but go ahead and raise your hand if you have one of those. I know I do. So I want you to imagine that diet and exercise pocket of fat. And what we do is we target that area by using cold temperatures. During the treatment, those fat cells cool down to the point where they crystallize. And then 2 to 3 days later after the treatment, those fat cells die through a natural process and your body slowly eliminates those fat cells. What we can do is with a single treatment, we can reduce the number of fat cells in the treatment area by 20 to 25%. Are there any questions so far? Okay. Good. So how do we know that cool sculpting works? Well, we have now over 10 years of the device being available in the US, and we can show that patients are experiencing what we call long-lasting results. This means that barring any major fluctuation changes in weight, patients are maintaining their results. We can see up to a 20 to 25% reduction with each treatment. One of the fun things that I experienced recently with these long-lasting results is I actually she's 9 months old now, had my daughter in February. And all of my treatments were done before I got pregnant. And during my pregnancy, I gained 53 pounds. What I did notice is those areas that I had treated with cool sculpting previous to my pregnancy stayed smaller than if they weren't treated. Now that I've lost the weight post-pregnancy, those areas that were treated with cool sculpting have come back to pretty much the same size and shape that they were previous to my pregnancy. So we can experience those long-lasting results. And once those fat cells are gone, they are gone for good. So a little bit about how long it lasts. We do see best results anywhere between 2 to 3 months after treatment's performed. Some people will notice it a little bit sooner, but we really like to look at that 3-month mark as the time at which you'll see your optimal results. Once those fat cells are gone, like I said, they're gone for good. Now, it is important to note that weight gain will need to be maintained post-procedure to maintain your results. Now at Welllife, you have an incredible cool sculpting expert, Jenna. Jenna, wave hi. Nice to meet everyone virtually. Hopefully we'll get to see each other in person. But what Jenna is an expert in is truly body contouring and tailoring a treatment plan specific to a patient's body type, their goals, and obviously their budget. So what Jenna's able to do is build a customized treatment plan, which would be developed during your consultation. Now, it's incredible that she can also do virtual and in-person consultations, depending on what you're ready for as of now. Treatments can be performed in as little as 35 minutes. Most people decide to have multiple areas treated in one day and use that day to relax or even take a nap. I know for me in all my treatments, I've usually taken a nap because you're not usually laying down in the middle of the day. I keep getting ahead of my slide. So on your treatment day, you are able to do just about anything. You're able to work. We now have people who are taking Zoom calls or conference calls from the treatment room. And what you're going to experience during a treatment is just some gentle vacuum suction that holds that targeted tissue in place while we deliver that controlled cooling. That controlled cooling can feel like a little tingle, stinging, achy sensation. But then after about 5 minutes, the area goes numb and you're incredibly comfortable and ready to relax. Now, I'm sure you guys have been sitting through the last few minutes thinking, okay, Lisa, let's just see the results. So what I want to do is take a pause. Mike, if there are any questions, let me know. Otherwise, I'll crack into the exciting part.
Yeah, right now, just a lot of comments on, everybody just really amazed at how cool sculpting works and the science behind cool sculpting. I know for myself, when we talked earlier, I've been considering cool sculpting myself. And I think that, we talked about the difference between one treatment versus two treatments. Can you talk a little bit about that?
Sure. So it all comes down to our clinical research and our experience with the device over the last 10 years. What we do see is with a single treatment, you're getting a 20 to 25% reduction in that area. Now, depending on the person and their goals, that might meet what they're expecting for the treatment. Most people do want more of a reduction, so they are looking at getting that second treatment to get an even further reduction, somewhere between 40 to 50% reduction with two treatments. So it will depend on the patient and the goals, and that's where Jenna, your expert, really comes in to help build those customized treatment plans, but also to be really honest with what can be achieved with cool sculpting.
To that point, Lisa, I would say you have to have realistic expectations going into cool sculpting. And I think Jenna could probably speak to this better than I could, but you can't, I think there is a limit to a BMI at which you can perform cool sculpting, because you can only take away so much. And that's why I think Well Life is such a great place to come, because we have other options to get you to the point where if you want the cool sculpting and you want to get that extra fat reduction, we can get you to the point where you're ready for that and it works much better. You'll have better lasting results, longer lasting results, and it'll just turn out to be a better procedure overall. Jenna, do you think you've seen that? Can you unmute your computer?
Right. Yes. Absolutely. There's only a certain amount of fat that we can get rid of. So the less that we start with, the more your results are going to be. That's where our weight loss program may come in. If you're not a candidate for cool sculpting right away, we would definitely be looking into trying to get you to where we could get you to your maximum results, your best results with cool sculpting.
And I love how you said that, as if you're not a patient right now, let's help you focus on those areas to get you to potentially become a good candidate for that treatment. And thank you both for mentioning the combination of weight loss and cool sculpting. So there is an ideal BMI for our patients with cool sculpting. It is a BMI of 30 or below. And what we look at is cool sculpting is really there to sculpt the shape of the body. It is not there to help someone lose weight. So if the goal of a treatment is for someone to lose weight, it's great for you to go to Well Life because there are solutions for specific weight loss. Cool sculpting is very specifically targeted at just sculpting a different shape of the body. So wonderful in combination with weight loss, hormone therapy, really, really brilliant results.
Lisa, we got a couple of questions from the audience before we move on into the segment. So a question from Susan: are there any health restrictions?
That's a great question, Susan. So there are a few what we call contraindications to a treatment with cool sculpting, 3 of which are very rare blood disorders that are related to when the body is exposed to cold and the blood responds in an unpredictable way. They're, once again, extremely rare blood conditions that are secondary to usually greater disease. And cool sculpting has been studied in adult patients who are deemed fit and healthy. Now, anything else that is outside of that is wonderful for you to go in and have a consultation with Jenna and Dr. Baumberger to determine whether or not the cool sculpting treatment is right for you. Taking into account lifestyle factors and other things involved, it's very specific to having that consultation.
Also, we have a question from Laurie, and Laurie's question is, can you have this done if you have had liposuction many years ago?
Oh, great question, Lori. So this is actually a very common procedure in patients who have previously had liposuction. And, a couple reasons why patients would have this treatment after their liposuction, whether it's been several years or it has been, only a few months after. There might be areas that they didn't have treated with liposuction that they would like to sculpt or shape. There also might be little areas to refine. There also might be, someone's not ready for surgical treatment. So to have a non-surgical option to shape and sculpt the body is very helpful. And that's when patients look to cool sculpting.
Speaking somewhat on that subject, we had a patient recently. We have had incredible results with the neck cool sculpting. That's probably been one of our best areas. But we had a patient come in recently that had previously had Kybella, and her results did not turn out as well as she would have liked them to turn out after the cool sculpting. Is there something there that may prevent the cool sculpting from doing a better job or not giving us the results we really wanted?
That's a great question. And I think, we could probably sit down and look at this as a specific case study. It may be, I'm not quite sure how close to the Kybella treatment she may have had the cool sculpting. In your experience too, it sounds like you guys are getting great results, like many of my doctors have across the globe with the cool mini underneath the chin. So it is sometimes perplexing whether or not they're achieving the results. One of the things to consider with the area underneath the chin is something like skin laxity. If a patient does have a significant amount of skin laxity, reducing that fat in the area may not give the result that they're expecting to achieve with cool sculpting. So that might be a factor, but we can sit down and use it as a case study and kind of look at the results for that specific patient.
And had one more question from Tina. Are there areas that cool sculpting is not recommended on? Like, what if there's a large amount of fat on the abdomen?
Great question. So cool sculpting can only target what we call the subcutaneous fat. So that's the fat that's soft, squishy, and sits right underneath the skin above the muscular layer. The fat on the abdomen that we cannot target with cool sculpting, nor can it be targeted with surgery, is what they call visceral fat. And visceral fat sits behind the abdominal wall and surrounds the abdominal organs. Now, the good news is this visceral fat, even though we can't treat it with cool sculpting or with surgical treatments, actually responds twice as fast to diet and exercise changes. So if a patient is not a good candidate on the abdomen at the time, it would be a great opportunity to speak to the team at Well Life to talk about some of the other medically managed weight loss options, or even looking into hormone therapies as well.
And one final question, and we'll let you show us some results here, Lisa. Getting a lot of questions here, which is great. So does your BMI affect the neck area and the cool sculpting you can do there?
So that's another wonderful question. And actually, our under chin treatment is FDA cleared for a higher BMI. It is a BMI of 42. However, we do want to make sure that those patients have the right expectations for the treatment and that it's medically suitable for the cool sculpting in that area. I would say that one of the most popular areas is this chin area, especially because many of us are so conscious about what our face is doing and feel like we can hide parts of our body with our clothes, okay, but it can't necessarily hide this, even though I can wear a mask now and maybe that helps. But this is an area where everyone is on Zoom now, and there's actually this trend around what's your Zoom face doing? And so that's a really popular treatment now, where we're seeing a lot of patients coming in concerned about the double chin.
Okay, great. So let's take a look at some results.
Wonderful. So we'll take a look at the results. This woman actually wanted to treat her abdomen and her love handles. Flanks is the medical term for love handles, although I always think about my own mother. And if I said, Mom, let's treat your flanks, she would ask me why we're treating a steak. So that's why I use the term love handles. And this woman really wanted to get her post-baby body back and really wanted to feel more confident and comfortable in her clothing. So she had one session of treatment on her abdomen as well as her love handle area. Now this before and after, the after photo was taken 16 weeks after her single pool sculpting session. This next patient wanted to really feel more confident in clothing, especially when she sat down. She felt like her pants were very tight and there was a little bit of tissue hanging over the top of her pants. So this is once again 16 weeks after her first session of treatment. Now this session included several different areas that were treated in a single visit, and she had both her abdomen area and the love handle area treated. What we can see in this before and after is, streamlined appearance of the abdomen, more of a sculpted and refined look, as well as a more sculpted area on her back and love handle. Now, pool sculpting is just as popular for men as it is for women. So if you're thinking about a gift by your loved one, nothing says I love you like the gift of pool sculpting. Just like women, men are concerned with that love handle and abdomen area. Now, this gentleman actually had 2 treatments of pool sculpting because he wanted to really sculpt and refine and reduce that area by about 40%. So what we can see is a beautiful reduction of the flank or the love handle towards the back, and a beautiful streamlined sculpted abdomen. And once again, this gentleman underwent 2 sessions of treatment. This is another gentleman who had 2 sessions of treatment, and I love this result because it really shows what happens to all of us as we age. We start to get those little creases right at our waistline as the tissue might become a bit more full of volume and maybe a little bit of laxity. What this gentleman had was a treatment to his love handle area, 2 separate treatment sessions, and now we can see this beautiful sculpted result where as we reduce that fat tissue, you actually see a softening of those creases at the back. Now, another popular area is the inner and outer thighs. This woman decided to have both treated, where when we treat both the inner and the outer thigh, we give this illusion of a longer, leaner leg and the illusion of what we call circumferential reduction. Now, this person had 2 sessions of treatment, treating both areas twice. And what we can see is a beautiful lengthening appearance of the leg line, a smoother contour of the outer thigh. Now, the outer thigh is a hugely popular area to treat because many of us are taking that opportunity to wear athleisure all day, every day. I know if I'm not out at work, I am living in leggings. And this area on the outer and the inner thigh really becomes more apparent to ourselves, probably not to anyone else, but to ourselves when we're in our leggings. And once again, this patient had 2 sessions of treatment on both the inner and outer thigh. Arms, as I mentioned before, was my #1 area of concern. And the reason why I was so concerned about my arms is because I hated being in pictures standing to the side with your arm like this. You'd have to do the skinny girl sorority arm, making sure it stays skinny. So I had that area treated just so I could feel comfortable and confident in photographs. Now, it was actually really great because when I first started noticing my treatment working, I noticed I had more of a definition of the tricep muscle in my arm, even though I hadn't worked out. It's an intensely popular area for treatment regardless of age, Whether you do want to be in sleeveless tops or you just want to be comfortable in the sleeves of your clothes, the cool sculpting treatment on the arm might be a great treatment for you. Now, as Dr. Baumberger mentioned, they're getting great results on the chin. The chin is quite possibly one of my favorite areas to treat because it really does change the shape and look of the face. This woman had 2 sessions of treatment, and what you can see is it's reduced the fat underneath the chin, but don't you feel like she looks younger? Like it's taken 10 years off of her face? This is the magic of, reducing that fat pocket underneath the chin to really give more definition and more of a youthful appearance. This person had 2 treatment sessions, of 1 6 weeks apart. So that's all I have for before and afters. I'm super excited to be with you and answer more questions. But to start your cool transformation, definitely get in touch with the team. You can call now and book your free consultation. You are in great hands with Jenna and Dr. Baumberger, and they're there to help you find a solution for your body contour needs.
Yeah, and just to reiterate everything, Lisa, and thank you very much for coming on tonight and teaching us a lot more about cool sculpting. I know I'm definitely a believer after looking at those before and after photos. I can think of like several areas I need to go ahead and treat like right away. But I think that, a lot of great questions tonight. And anybody that, you've asked some questions, if they didn't get answered, go ahead and call in to our line and talk to our experts here at Well Life. We're here tonight. Or go ahead and set up your virtual or your in-person consultation at no charge so that you can find out more about cool sculpting. And next, we're going to give away a single treatment here in our segment giveaway. We'll give a single treatment cool sculpting away. And Dr. Baumberger, has a name been drawn yet?
I have it right next to me, but Mike, our chair is empty right now. I'd like to go ahead and get started. But speaking to the results we've seen also, the other day we had some fantastic results that Jenna showed me where we actually cool sculpted abdomen and flank, but we took back fat pictures, and the results were amazing. We did not treat the area, but you would have thought that he had his back fat treated because it was almost completely gone because of the loss in the front that pulled everything forward. And it was just an amazing result.
You see that beautiful.
Did I get that right, Jenna? Thank you. And I did draw a name. Let's see what we got here. Barbara Brown.
All right, congratulations, Barbara Brown, on winning a single treatment cool sculpting.
Congratulations, Barbara.
And thank you, Lisa, very much.
You're very welcome. If you don't mind, I'm going to stay on and I'm going to learn more about what you guys do.
Yeah, absolutely.
I'll throw your name in the bowl.
So I've had a few questions tonight and would be remiss not to remind everybody, everyone that's attending the live show tonight, you're going to get a gift bag. And so we've got some amazing gifts in that gift bag as well. So just give us a call, when you want to come by. Those gift bags will be ready next week, and then we'll bring them down to you, or we'd love to have you come up and do a free consultation on something that you might like to learn more about, and if it's right for you, if it's a treatment that's right for you. Dr. Baumberger, I'm going to kind of throw Jenna a curveball. Hello, Jenna.
Sorry, Jenna.
Jenna, I'd like for you to talk to us a little bit about our other skincare products. And I know that there's been several questions from the group tonight about organic products and about plant-based products. I've gotten several of those questions on the chat tonight. Can you tell us a little bit about, do we have a product line that's organic and plant-based?
We do. That line is called Farmhouse Fresh. They actually have a farm with animals, so the proceeds from the products that you buy supports that farm and helps support those animals, feed those animals. If you go to their website, you can take a look at, they have some live goat cams and stuff like that that you can look at the animals on. But yes, they're all plant-based, vegan, cruelty-free, obviously, because of the animals that are involved in the farm. And they are very good products. They smell wonderful. They have something for everybody.
On that note, Jenna, I know we have several other skincare lines that we would probably like to touch on as well. For those of us that, you know, I mean, Obagi is a wonderful product I've used it myself. I love it. But we also have several other wonderful skincare products. And if we could mention those maybe briefly now.
Of course. So yeah, we also have Revision Skincare. They are a wonderful medical grade skincare brand. One of my favorite products from them is called Nectifirm. It is a neck firming cream. And touching back to the cool sculpting on the double chin, I love to pair Nectifirm with the cool sculpting treatment for the double chin area, because what Nectifirm does is tightens the skin and helps improve the overall appearance of the skin on the neck. So that's one of the best products that I enjoy from that skincare line. They also have really wonderful day creams, night creams, and eye creams that are in the DEJ line, which is the dermal epidermal junction. That's what the line is called. And they're good for overall skin health and just wonderful to use day, night, whenever you need to. I'm not hearing. I'm sorry, I can't hear for some reason.
Muted.
Okay.
They also have developed that line also to treat what we're now calling the 5th layer of skin. Is that correct? And what would that be? The
sorry.
it has a probiotic skin.
Yeah, the probiotic layer.
Probiotic
Yeah.
that would treat the superficial layer.
Exactly.
And also going back to the Nectifirm, the other thing I like about Nectifirm and the cool sculpting in the neck is, one thing I've always said is, with all of the advancements we have today with our fillers, with our Botox, with our products, you can no longer look at a woman's face and tell how old she is.
Right.
You look at her neck or you look at her hands. And so cool sculpting your neck or cool sculpting your hands or working on your, or not cool, but or working on your hands or using Nectifirm on your hands, you can get where you can't tell even by someone's neck or by their hands their age. And
appearance overall.
most of us, that's what we're looking for. We're looking for people to not be able to tell.
Right. That's
I'm a
exactly
huge believer in the Revision Body Firm as well with cool sculpting. I absolutely adore the product. You know, post-pregnancy for me, their Body Firm gave me the confidence back in my abdominal skin. I did not expect for that skin to look lax and almost like it had cellulite on my abdomen. And it was about 3 weeks of religious use of the Body Firm. I would speak volumes to every patient about Body Firm, and you know, I don't sell it, but I would love to. I smothered it after I had the baby.
We do love Body Firm around here.
Yes.
And we also have a product line, Eye Image.
The Skin Image product line. They have several different skin treatments, chemical peels. They have an oxygenating facial, which is actually a kind of a bubbly facial on your skin. We have lots of at-home treatments that you can use from that line as well. Lots of vitamin C, lots of good sunscreens. Whatever your concern may be, we definitely have a product for you here.
And what would you consider the one skincare product you can't live without?
For me, probably a vitamin C serum. A good vitamin C serum, very good for any type of skin. For me, I even feel like it may help with breakouts due to those anti-inflammatory properties that vitamin C does have. But helps with brightening, helps with breakouts, helps reduce any inflammation, hence why it's good for people with rosacea. That's my favorite skincare product for sure.
Also, let me throw in sunscreen. Got to get on the medical side for a second there. Sorry.
Yes, sunscreen every day.
So you don't get your wrinkles back.
Right.
So Dr. Baumberger, I would love for us to go ahead and do some giveaways. Do we have any farm fresh products that we can give away tonight?
We do.
Cool. What are we giving away?
I actually left it at home, but so I cannot show it to you. However, I can draw a name for it, but it is a comprehensive package with multiple samples of different products that they carry, which you can come by next week anytime. Come by, pick it up. If you let us know you're here, we'll bring it down to you at your car. You don't even have to come in. That way you'll be protected and you won't have to worry about putting the mask on, riding the elevator, because we have the oldest elevators in Macon, Georgia. But the winner is Amber. You may have to help me on this. Her first name is Pam. That's about all I can read. What you got here? What is that last name? She can't even read her own handwriting. She's gonna have to look that up. Okay, Pam, somebody.
How do we spell Pam's last name?
I think, what is this here? I need my glasses.
Lincecum?
Lincium? Is that right? Lincium? Lincium.
Pam Lincecum? Yep, we have a registrant by that name, and she is online with us tonight. So congratulations, Pam Lincecum, and I'm probably mispronouncing your name, and I'm terribly sorry for doing that.
I'm sorry, I couldn't even read it.
Congratulations, Pam, on winning some Farmhouse Fresh, the complete package of the multi-product that Dr. Baumberger referenced. And we also have some revision to give away tonight, don't we, Dr. Baumberger? We do.
Thank you. Of course we do.
Absolutely.
Let me see what we got in here.
We were not able to get our support guy online with us tonight, but he sent some great product that's basically good for anyone of any type skin to use. A good hydration type product. And so who can we give some revision to, Dr. Baumberger?
Certainly somebody that I very much hope is watching, because she is very dear to me, Debbie Johnson.
Debbie Johnson. Congratulations, Debbie Johnson, on winning the revision giveaway tonight. And we just had a question from Cindy. Do you sell samples of the Farmhouse Fresh products? And we do have some small sizes that we sell, right, Jenna?
We have small sizes, and we also will, we have larger products that we will make sample products for you if there's a specific product you would like to try out. We have smaller containers that we will take some of the product from the larger container and do that sterilely. And if you want to try out different products, we can give you different lines and different products, and then you can determine which one works best for you. Because I know it took me a long time to figure out which one worked best for my skin and didn't break me out, and also didn't peel my skin off within 2 to 3 days. So it's a lot of trial and error, I think, when it comes to the skincare products, because we all have different skin.
Definitely. All right. And so now I'd like for us, if we could, I want to bring on our subject matter expert around IV hydration therapy, our illustrious nurse practitioner, Kaylin Slack. Welcome to the program, Kaylin.
Welcome, Kaylin.
Hey, how are y'all?
Good. How are you?
I'm doing good.
So tell us, Kaylin,
right.
What is IV hydration therapy?
So IV hydration is exactly what it sounds like. It is a way to offer IV minerals, vitamins, antioxidants, amino acids straight to the bloodstream, typically through a IV, hey, Ms. Kitchens, typically through an IV or an injection. It is my personal favorite about it is that it's 100% bioavailable. So even with a healthy system, we're optimizing everything that we can do. You're most fit we still only process about 30% of the vitamins that we take in orally. So with the IV hydration, you're able to do that at 100% and use those vitamins, minerals, and antioxidants to your benefit. IV hydration can help you with some of the things like fatigue, which I'm sure most of us suffer with, even if it's just from being inside during this COVID time. Energy boost, help with dehydration. I don't know how many times I've said I need to drink more water, and I probably don't do it. So just hydrating yourself, immunity boost, which we can all use in this time, helping with athletic performance or recovery, even reducing visible signs of aging and skin health issues. It can also assist with that. Just overall wellness. I know there's quite a few patients that we have that some of them suffer from migraines, and some of the effects from that IV hydration can even help and benefit with that as well. So I'm all on board with the IV hydration. There's several different packages and things that you can put together that will specifically benefit to your needs and be tailored to your needs. And that's one of the other great things about it, is that it's not necessarily a one size fits all, but it's just a one size fits your needs. And we're here at Well Life to help you figure out what that is and help you with your overall health and wellness.
So if I could ask you a couple of questions about IV hydration
Sure.
therapy. Just because it really appealed to me, because, being older, I feel run down, lose energy. So is IV hydration therapy, is it good for that? Or, can I expect to feel better with IV hydration therapy?
Absolutely. And just with any other treatment, of course, like I said, it's customized and tailored to what you need. So if a boost of energy is what you need, then we customize it for that. I definitely won't say it's like drinking an energy drink, but I will say that the effects are definitely lasting. I can speak from personal experience from doing IV hydration. I was kind of a skeptic in the beginning, to be very honest with you. And after doing it, I felt better. It was a subtle, gradual, I'm not feeling so run down. I didn't need to reach for that extra Red Bull or extra coffee at the end of the day. So definitely fatigue is one of the significant benefits of it. And just truly being dehydrated can add to your fatigue symptoms and sometimes other symptoms that you may be having in your life.
So got a couple of questions for you, Caitlin.
Sure.
Lana wants to know that, or is stating, IV hydration seems like an excellent option for fibromyalgia patients.
Absolutely. So there are a lot of studies out right now that have benefits definitely for fibromyalgia and for chronic pain patients in general. Typically, those patients, in addition to being dehydrated, require more anti-inflammatory. So that's where the vitamin C and vitamin B12 additions can come in for that. I've definitely seen great effects, and it is a great adjunct to some patients who are on chronic pain management as well, to help assist. And sometimes they're able to go down on their pain management. So definitely great for chronic pain, migraines, fatigue, fibromyalgia, definitely a great adjunct to it. And for the gastric bypass patients, so those who aren't able to take their vitamins orally, or they're not absorbing them well in the gastric system just from, previous surgeries, it's also a great addition for that.
And Angela wants to know, how often can you get IV hydration?
So the services are different for everybody, just depending on which IV hydration package that you get. But I would say you can get IV hydration pretty much once a week if you like it.
And how much does it, Anna wants to know, how much time does it take to get the infusion?
Oh, no more than 30 minutes or so. It's really an in and out, watch your favorite show. Mm-hmm. Sometimes it runs a little faster than that. Sometimes it runs a little longer, but like she was talking about earlier, take a Zoom call, listen to some music, or take a nap. And we're there to just monitor your IV or your injection and get you started.
Awesome. So, ladies and gentlemen, go ahead and give us a call to line up your consultation with Caitlin and come in and talk about, is IV hydration therapy right for you? Believe me, I'm definitely going to probably be one of your patients there, Caitlin, real soon. Maybe tonight before we go home.
I think so too, Caitlin. Thank you very much.
Thank you.
Mike, we have a lot of other territory we need to cover that people are asking about.
Yep.
Botox, filler, microneedling, hydrofacials.
Absolutely. I was saving some of the
Probably
best for
move
last.
along and maybe save some questions towards the end.
Okay. All right. Well, let's go ahead and jump right into Botox. And Dr. Bomberger, would you like to take the helm on that one?
I was expecting a video, but okay.
Yeah, let me go ahead and I want to pull up the Botox website. If you could talk a little bit about what Botox is while I bring that up, that would be great.
Botox is actually botulism toxin in very small amounts that we use to paralyze muscles that cause wrinkles. The frontalis muscles across your forehead contract and pull those muscles and form the lines that you see. The sooner you start making those muscles still, the longer you're going to delay forming those wrinkles in your forehead. I've always said to people, start Botox before you get those lines, because then you will not notice when you need those lines, and no one will notice that you're aging. You'll stay at the same age as the day you got Botox. The nice thing about Botox is it's a 15-minute procedure. It's very little risk involved. Very easy to do. I just lost my screen. I can do anything.
I'm getting ready to run a Botox commercial here, but we still got you live.
Where am I? Okay, there we go. How do I do that?
So yeah, let's go ahead and run the commercial. Can you guys see that?
Because I have lost my screen. Can somebody help me? What have I done? I'm gonna mute me for a second.
Hey, Jenna, can you see my screen okay? Okay, great. We're going to go ahead and run the Botox commercial. Then we'll come right back into the segment and look at some before and afters.
You know that look? That life of the party look. Walk it off look. 1 more mile look. Reply all look. Own your look with fewer lines. There's only one Botox cosmetic. It's the only one FDA approved to temporarily make frown lines, crow's feet, and forehead lines look better. The effects of Botox cosmetic may spread hours to weeks after injection, causing serious symptoms. Alert your doctor right away, as difficulty swallowing, speaking, breathing, eye problems, or muscle weakness may be a sign of a life-threatening condition. Do not receive Botox cosmetic if you have a skin infection. Side effects may include allergic reactions, injection site pain, headache, eyebrow, eyelid drooping, and eyelid swelling. Tell your doctor about your medical history, muscle or nerve conditions, and medications, including botulinum toxins, as these may increase the risk of serious side effects. So give that just saw a puppy look, and whatever that look is. Look like you with fewer lines. Own your look with the one and only Botox cosmetic.
All right, so everybody saw that commercial, a quick snippet about Botox, and I want to run one over Juvederm.
Welcome everyone, and thank you for joining us live. I'm Brooke Loftus, and I am thrilled to be your Cool Sculpting host.
Yep.
We're filming an absolute.
There we go. Okay, sorry about that. All right, Dr. Bomberger. You're muted. There you go.
Okay. I can't, when it says unmute, I think I'm unmuted. That's brilliant. But
No worries.
Kaylin's laughing behind her back now at me. But it not only smooths out the forehead lines, you can use it for, and Mike, you're a perfect example if you take your glasses off for us. We just did his last Thursday, and what they call the glabellar lines, or some people call them the 11. There's another word that I won't refer to, but his went almost to his mid forehead. It has been less than a week, and we have taken this down significantly. His forehead lines were exceptionally deep. Raise your forehead for us, Mike. That's what they look like to begin with. in 4 more days, you will not be able to see those. Now, because I've been doing Botox a lot longer than Mike, I had mine done Thursday, and I like to recruit muscles. So I do have one that Jen is going to have to stick me in the top of my head to get rid of. But the others have already smoothed out within 4 days. The crow's feet, I have the worst lighting in the office, so anybody else will be better than mine. But I don't think you could see him if I tried.
Yeah, definitely. The crow's feet around the forehead area, that's where I've seen the biggest change so far. And it hasn't even been a full week yet since I had my treatment. That's
And
what
if you could have seen the line that was on the right side of his eye, you would be amazed at how improved that is. I actually thought at one point we were going to have to put filler in, but now I believe with more time, the Botox is going to completely take care of that line in and of itself. I mean, there are things Botox, of course, can't do. The marionette lines that we have, those would require filler. The difference in the two, filler is a more thicker, a heavier molecule. It lasts longer. It stays 18 months to 2 years. Botox has to be repeated more frequently because we use such small amounts. We don't want to paralyze you completely. It's every 3 months, but the longer you do it, the longer the effects will last and the better the effects you will get.
So we were talking about Juvederm, right?
Well, we're talking about several. Allergan makes several lines of fillers that vary in density and water solubility. And the thicker ones like Juvederm, you would want to use to raise cheekbones because you want to get that pull in the muscle. For fine lines around the mouth that smokers get, that people that like to drink out of straws will get, and that some just unfortunate people get for no reason whatsoever, you would want to use something like Bulbella because it's a very small particle and you need very little of it, and you don't want to get overfilling of the lines. And the nice thing about the fillers as opposed to the collagen we used to use is it doesn't last forever. So if there is an outcome you don't like or unhappy with, it doesn't last forever. And we have a hyaluronic acid that we can actually go in and reverse some of the filler that we have placed.
So I know we've heard several people talk about hyaluronic acid tonight, and I know that we haven't had a chance to look at and talk any about microneedling or hydrofacials yet. But when we're talking about hyaluronic acid, how important is that for the face to in the healing process?
And actually, I spoke out of turn on that. I used the wrong term. Hyaluronic acid it's a moisturizing substance that has 100,000 times the permeability of water in skin. So if you really want to plump your skin and fill your skin and keep it soft and moisturized, hyaluronic acid is the way you want to go with that. It's great post-procedure because it helps keep that moisture in and keep that fullness in after you have procedures. So it's one of the most important things in keeping that youthful, full look to your face.
So it definitely explains it for me, because again, when it comes to I just did my Botox treatment the other day, and I'm ready to move forward and get the filler. And our Botox folks have given us a generous supply of Botox and filler that we're going to give away tonight. So, but typically, we need to see the person or do an online consult with them before we know which way to consult with them and guide them to, right?
It depends on the outcome they want. It depends on what they're looking for. If they're looking for the forehead wrinkle lines to go away, or the crow's feet, or the glabellar lines to go away, you're looking for Botox. If you're looking for marionette lines, if you're looking for the deeper facial lines, if you're looking to tighten or fill skin and remove some of the wrinkles under the eyes from the shadow from the fat pad, you're looking at filler.
Right. Okay. All right. Well, we've got some giveaways. It looks like that our Botox rep has given us a box, 6 of the Botox 50 unit vials, Dr. Baumberger. So how many treatments is that?
It all depends on how many areas you need treated and how many areas you want treated.
Gotcha. Gotcha. So typically, probably about a 2 area treatment is what we're looking at initially on our initial giveaway. Then we're going to move some into the grand prize.
A 3 area treatment is really initially what you're looking at, because you would be looking at the forehead, the crow's feet, and the glabellars. And so you would be looking about 64 units total with the first treatment.
Okay. All right, great. Well, have we got someone that we can go ahead and give that treatment to for our Botox?
Allow me to pick an 18-year-old out of here. I have no last name on this one.
Ah, okay.
I have an initial.
Okay.
I don't know what to do with that.
If we don't have a full name, then we can move on and pick someone else.
Let me see if I think Amber is looking.
Okay.
I don't want to give it away because that's a really we'll just figure it out and we'll find out who Deborah P is and we will get back to her.
Deborah P.
He has
Okay.
gotten the Botox.
All right, Deborah P., you have won the Botox treatment in our segment giveaway. Congratulations, Deborah P., and we will contact you, and we'll also post all of our winners on social media as well. And we've also got a Juvederm treatment, looks like a 2 area Juvederm treatment that we can give away as well. So we have someone that we can go ahead and draw for the Juvederm filler.
Donna Parnett or Parrot, excuse me. I can't tell if it's an R or an N, but Donna Parnett or Parrot.
Okay, Donna Parnett. All right. Congratulations, Donna, on getting the Juvederm treatment.
Oh, Deborah Pace. Congratulations on the Botox.
Deborah Pace for the Botox. Congratulations, Deborah Pace. Nice job. And we got a couple of questions that have come in. Lana wants to know, let's see. Oh, just making a statement. Her screen. Let's see. Oh, okay.
I'm trying to answer y'all's chats, but I'm having a really hard time figuring that out.
So guys and gals, if y'all want to go ahead and set up your consultation for your Botox treatment, please give us a call. We're running specials on our Botox treatment and our Juvederm treatment, as well as all of our services tonight as well. And so I'm not sure, we've been having some technical difficulties on running the videos tonight. I wanted to run the video on from our hydrofacial person and see if that comes up. And let's see here. I'm going to attempt. Everyone, we are really excited to have. I'm going to attempt to share my screen one more time and see how that works out for us. You guys keep me honest and let me know if we're able to see that video. Let's see. And get rid of this screen. Everyone, we are really excited to have with us this evening Christy Morgan. She is our hydrofacial support person that takes care of everything that we need at Well Life Medical Spa in the realm of hydrofacial. She provides all of our training, our resources, and she's also giving us some goodies to give away tonight for the virtual spa party. Christy, thank you so much. It's an honor to have you with us.
Thanks, Mike. I'm excited to be here. And I just wanted to talk to everyone tonight about the Hydrofacial Deluxe and the Platinum Hydrofacials. So let's start with the Hydrofacial Deluxe. Essentially what that's going to be is it's your hydrofacial, which is going to give a double exfoliation similar to a microderm, but with comfort and no downtime. We're also going to do a little chemical peel with that also has no downtime, followed by pain-free extractions. At that point, we're going to personalize your treatment. So if you're dealing with hyperpigmentation, redness from rosacea or inflamed acne, you may even be dealing with just a little bit of aging or visible signs of aging like I am around the eyes. Go ahead and have that personalization. You can also personalize your tip and the aggressiveness of your exfoliation. So we like to start with a sensitive tip, but then we can move into something a little more aggressive. If you have thicker skin or if you are a little more congested, we're going to make sure that we open those pores, really clean them out, and personalize that treatment to make sure it's just right for you. The other thing that we offer is the Platinum Hydrofacial. So that is everything that I just talked to you about the Deluxe, and then we're going to incorporate some lymphatic drainage. Lymphatic drainage is fantastic for the body. About 30% of your lymph nodes are in your face and neck. So when we do a little lymphatic drainage there, we're going to get rid of toxins in the body that come from everything you put into your body. Even drinking water has toxins, right? So if you're feeling sluggish, if you have allergies or chronic headaches, this is a great treatment for you. One thing that I've noticed is that people carry a lot of inflammation under the eyes. So when we do the lymphatic drainage, you start to notice some contouring in the face, which is always exciting. So along with the physical aspect of, or the health aspect of what lymphatic can do, it also offers a little bit of physical aspect as well. And then Lord knows in this time, we all are thinking about wellness. And if you have a healthy lymphatic system, your immune system can work properly as well. So it's definitely not going to hurt you to do that. One of the things that I love about Well Life is that Jenna and Caitlin are experts in this industry. They're wonderful with hydrofacial. And when we talk about personalizing that treatment, they can start with dermaplaning if that's what you'd like to do. They might decide to incorporate some LED light for you. LED is fantastic. So the red light is there to help stimulate a little bit of collagen. It's also going to help calm redness. So again, kind of going back to that rosacea or inflamed acne, we can do a booster to calm that and actually start to heal that from the inside. And then that red light is going to do a topical job of calming that redness. And then, of course, helping with the anti-aging and product penetration. Once we finish with that LED light, we're going to incorporate a hyaluronic acid, an antioxidant, and peptides. I mean, I call that the liquid gold of the hydrofacial. It is hands down the best thing you can put on your face. So we're talking about incorporating something that would take 5 or 6 treatments and doing it all in one 45-minute to an hour treatment. And I do know that Well Life is offering specials tonight. So if you reach out to them, they're going to be able to provide you with what those specials are. I highly recommend that you take advantage of this, not only because of hydrofacial, but because of who the providers are. And then, Mike, did you have any questions for me or?
Yeah, absolutely. And the visual that I pulled up for us is just showing everyone how they can actually build their own hydrofacial. And of course, our estheticians, Jenna and Caitlin, they're going to help you determine what's best for your skin and what kind of goals you have for the outcome of the hydrofacial, short term and long term. So really, we talk about incorporating the LED lights. So I guess, typically when I've thought of hydrofacial, I just thought it was basically a facial massage with a machine, because I'm like illiterate when it comes to hydrofacial and I don't really understand what all's involved with it. I've heard that it's very relaxing to have a hydrofacial. Is that really truly the case, or is there any pain involved, or?
There should not be any pain involved. It is a really relaxing, but results-driven hydrofacial. So one of the things that I absolutely love about hydrofacial is that at the end of it, there is a little jar in the back, and everything that we pull from the face kind of collects back there. And while that might seem gross, it's also very satisfying, because you want to know that what you're doing is working, and that the proof is in the gunky jar.
So I just wanted to kind of give you guys a taste, and we're going to post this over on social media as well, so that you guys can actually, see the rest of the video. But just wanted to kind of give you a taste of what we're doing here at Well Life to make sure we get you guys, covered when it comes to, whoops. There we go. All right. Just want to make sure I was back with you guys. So we're going to post this live on our website and across social media, the rest of the video, but we actually have a hydrofacial giveaway. Dr. Bomberger, don't see Dr. Bomberger. So Jenna, while we're waiting on Dr. Bomberger to come back, can you tell us a little bit about the difference between the deluxe and the platinum hydrofacial?
Yes, of course. So basically the deluxe and the platinum, the main difference is going to be that lymphatic drainage that we're going to be performing. They're the same except for that beginning step of the lymphatic drainage.
Gotcha.
She's back.
I see. I caught her off guard a little bit. So, Dr. Bomberger, we've got a giveaway to do. We've got a deluxe hydrofacial that we can give away. And do we have a winner?
Where's my face?
There we go. We got you now.
Can you see me?
Yep, we can see you and hear you.
Okay. I had to get Amber in here. I was like, I had to, you probably heard it on the phone. Never mind. Wow. Shouldn't be allowed to do this.
So do we have a winner for the deluxe hydrofacial?
Oh, yes, we do.
Uh-oh.
Anna Smith. And I would also like to thank her for all the information that she sends me.
Who is this?
Anna Smith.
Anna Smith. Okay. Congratulations, Anna Smith, on winning the deluxe hydrofacial. And if any of you guys want to call tonight to find out more about the specials that we're currently running on hydrofacials, and we also have the ability to do some amazing upgrades as part of some giveaways tonight as well. So I think Kaylin and Dr. Bomberger, we've gotten some questions around the BioT medical hormone pellets. Can you tell us, Dr. Bomberger, what is hormone pellet optimization?
Now I can see me. Thank you. Well, with BioT, hormone pellet optimization it's taking your hormone levels and bringing them back to levels that you had when you were much younger, when you were in your 20s or your 30s. And it's the pellets that we used are soy-based, yam-based, bioidentical. They're inserted into the subcutaneous tissue of the buttocks. They last 3 to 4 months in women, 6 to 7 months in men. They're estradiol and testosterone pellets. And they serve multiple purposes. In females, they help with hot flashes, night sweats, sleeping, irritability, depression. They are not a weight loss treatment. However, adjusting the hormones to the correct balance for you will help you. If you exercise and eat right and eat healthy, it will help burn fat and build muscle. It helps with increased libido, increased sex drive. For men, of course, number one on their list, it helps with erectile dysfunction. It helps with vaginal dryness, painful intercourse. It basically it really is for those who have tried other forms of hormone replacement and not gotten optimal results. These results have really turned out great. And 90% of our patients after their first or second round continue on indefinitely.
So I know that you've got a lot of clients at Well Life that elect to go with the hormone pellet optimization. Now, do they have to draw labs and find out where their hormone levels are? Is that the first step?
The first step is to draw the labs, find out where their hormone levels are. Insurance does cover the labs and that part of it. The pellets themselves are not covered by insurance. Insurance will not cover any of the hormone therapy. However, if you have a flexible spending account or an HRA, that can be used. And we also have a financing program where you can finance it over interest-free over a year.
That's awesome. And I've got a question here from Cindy. How often can you get the pellets?
You can get as a female, we check your levels. I got to get this right. 4 weeks post pelleting. And if you need a boost, if your levels are too low, we do the additional boost at that time. If we go beyond 8 weeks, we cannot pellet again until the 3-month period because we'll start stacking hormones and we don't want to over optimize you.
Gotcha. And I've got a lot of people here commenting on how fantastic the BioT hormone pellet optimization is. And so is this mainly for people that are getting on in years where their hormone levels are dropping, or can this be for any age? I mean,
this is from anyone from 20 to 120.
Wow.
If you want to feel better, if you want to get back to that overall sense of well-being, this is a great way to do it.
That's awesome. And I'm just seeing the number of people coming through here that are just raving about having the BioT, and it's awesome that
I'm telling you, people who talk about it, who tell you they start, will tell you they never want to stop.
That's incredible. And so I've got a question from Tammy. What are possible side effects to the BioT?
There's several, depending male and female. Most of them will go away after the first or second round. They definitely become less severe after the first or second round. And we can adjust your dosing on your testosterone and estrogen to decrease the side effects that come along with the pelleting. But I've lost the question.
Yeah. So that was it, just the possible side effects from
no. You can get hormonal acne because of the testosterone. You can get, some women will get hair growth and some women will actually get hair loss. Again, we have medications we can use to treat that until we get you optimized on the dose that's best for you, as well as after the first, like I said, to second dose, usually the side effects start dissipating somewhat. Okay. You can get local site infections. Out of probably 200 to 300 pelleting, we've had one cellulitic infection that was minor, that was treated with topical antibiotics and resolved immediately. And then we've had one extrusion, which is not anything you can prevent. If that happens, you can try and pellet again. If it happens a third time, that means your body's rejecting pellets and you're just not a candidate and you have to go a different route. But we've only had one patient out of all the patients we've pelleted that has actually happened with. We do see some swelling sometimes in women early on due to the testosterone. We have medication we can use to treat that again, and that does tend to go down again the more rounds of the pellets that you do. In the males, occasionally, if we overshoot the testosterone, we can see some aggression or some anger, but that again can be adjusted.
So it's pretty safe to say this is something that someone really needs to come in and do a consultation with you to see if it's actually right for them.
Well, not even necessarily a consultation. If they want to talk about it further, learn more about what it can do to provide health benefits, such as, preventing dementia, again, the things I mentioned before, the overall sense of well-being, we can discuss that further. We have books that we will give out that you can read about the pellets, the ones that we use, and learn more information. But really, if you decide you want to do it, you can just come in, have your hormones drawn, and just see if you're a candidate for the procedure. And then if you want to come in and discuss it and say, well, what does this entail? How long does it take? What am I going to get out of this? Then we would bring you in. And as I mentioned before, and this is worth mentioning again, as with all of our procedures, the consultation is free.
Awesome. Awesome. That's great. And so are there any more questions from anybody in regards to BioT BioT hormone pellets? Don't see anything else on the chat or in the Q&A. And so, Dr. Bomberger, I'd like to give away a free facial to someone. Do we have a winner?
Oops. Of course we do. Mary Ingram.
Mary Ingram. Congratulations, Mary Ingram, on a free European facial. That is awesome. All right. And we've also had some folks asking a little bit about microneedling. And Dr. Bomberger, we did a video with Jenna the other day. Would you like to run the video, or would we like to have Jenna talk about microneedling live?
Jenna, how would you be more comfortable? I do not mind running the video. It is my face she is using.
Actually, we just did a one-on-one interview with Jenna around microneedling and what it is. But yeah, we're going to
run the video.
We're going to post those photos and those videos on the website of the procedure and on social media.
Whatever works, I can talk about it. I can talk about it live. That's fine.
Okay.
So microneedling is a great skin treatment recommended to do in sessions of 3. So you would do one treatment and then another treatment 30 days later, another treatment 30 days later. The benefits of microneedling are collagen production. We're causing micro injuries to your skin and underlying tissues that force your body to heal itself, thus creating your own collagen. It's great for fine lines, for wrinkles, for scars. It's great just for overall skin health, improvement in skin texture. It's one of my favorite things to do here, actually.
What is the purpose of doing the microneedling? I mean, I know a lot of people have it done, including Dr. Bomberger, and I can't wait to post those videos and those photos, especially the before and afters. What do people get the best benefit? What is the best benefit of microneedling?
I would say definitely the collagen production. That's going to decrease the fine lines and wrinkles. It will help decrease any scars. Lots of people have acne scars or skin cancer surgery scars on their faces. And we can definitely improve the appearance of all of those things with microneedling.
And so is microneedling, is it like an injury to the skin? Is that?
Right. So we're using the skin pen. That's the name of our microneedling pen. It's FDA cleared to create little tiny holes in the skin. Now you cannot see the holes, but they create little micro holes in the skin, which forces your body to heal and create its own collagen. So yeah, it's a controlled injury. Just like whenever you would, if you were to injure yourself, cut yourself, your body would heal itself, but you may end up with a scab. With microneedling, we're controlling it. So you're not ending up with a scabby face, but you are ending up with your body regenerating its own tissue.
So you're stimulating the face to go through the natural process of healing so that it can get rid of those fine lines and wrinkles.
Right.
Great. And how painful is it?
It's really not painful. Dr. Bomberger can definitely attest to that. I use a topical numbing cream. It's a benzocaine, lidocaine, and tetracaine. We apply that for 20 to 30 minutes prior to the treatment. Then we remove it and we start with the treatment. The only area that people may feel any discomfort would be some around the nose, and it's not even pain. It's just more of a tickling sensation there. It can kind of trigger a sneeze. So that would just be something I would need you to let me know if you need to sneeze so I can pull the device away. But no, it's not painful. And we definitely make sure that you're completely numb before we start going with the deeper microneedling.
So Dr. Baumberger, when you had your procedure the other day, did you feel any pain?
No, I felt no pain at all, but I am a big baby and I make Jenna leave the lidocaine on my face a lot longer than most people.
We also went the full depth of the microneedling pin on her. So we went as deep as we could go and she felt no pain. So that really speaks to how good our numbing cream is.
Oh, absolutely. And so what is the best course of treatment after you've had a microneedling procedure?
So a good post-care regimen is going to maximize your results. We actually have from our Skin Pin company a take-home kit that we give each patient who has microneedling. It has several different products, and on the box itself, it has laid out exactly what you do and when and how. So AM, PM, you put this on in the morning, you put this on in the nighttime, and it's got it laid out days every day afterwards that you're doing your post-care treatment.
So how often can you get microneedling?
So like I said earlier, definitely packages of 3 are going to really get you the most results. You want to stimulate that collagen and then continue to stimulate it. Those can be done every 30 days or so. And I would say at least once a year, but some people like to do them more frequently than that. Dr. Baumberger, she likes to try and get a microneedling in every 1 to 2 months. And that's perfectly great. It's wonderful for her skin. If you've seen her in person, you can definitely see those results. You can absolutely see them here as well, but in person, they really shine.
Absolutely. And so is microneedling good for men?
Absolutely, yes. So men actually tend to have deeper lines than women, and the way that their aging process occurs looks a little bit different. So we can definitely improve the aging process, the look of aging on men just as much as women. We may need to go deeper in depth on the microneedling itself, but we can definitely treat men as well. Men are perfect candidates for it.
So is there a specific skin type, like say if somebody has acne or skin cancer, can they get microneedling?
So that's something that you would not ever want to microneedle over, something that's active. So a skin cancer, if you were to microneedle over a skin cancer, you risk spreading it. And with acne, if you have active pustules, so like whiteheads, if you will, you don't want to microneedle over those because you would be pushing the bacteria from the acne lesion deeper into the skin, and that would just cause more infection, and we don't want that. So as long as the patient doesn't have any active acne, active skin cancers, or eczemas of the face, we can definitely treat them.
Okay. All right. And so I think, the main thing, and of course the biggest question that we're getting is, does it hurt? And so I think we've covered that pretty good. And so we're getting ready now to do the drawing for the grand prize. But I know Dr. Baumberger, I want to try to run this video real quick because Dr. Baumberger wanted to show our office off, and I did a quick video this afternoon of our office, and then we'll go ahead and roll into the grand prize giveaway. So remember, everyone that attended tonight, you get a gift bag. So every single person that was online with us tonight, you get a gift bag. Again, give us a call, come by.
Did we do the hydrofacial boosters?
We did, we gave away the deluxe hydrofacial. We can actually do a drawing for another one. I believe we've got enough.
Because we got 4 boosters on the hydrofacials.
I'm sorry?
We have 4 boosters on the hydrofacial.
Okay. So that would cover us doing another deluxe if you'd like to go ahead and give a deluxe away.
We can do that.
Awesome.
Tina Scott.
Tina Scott, congratulations, Tina, on getting the deluxe hydrofacial. Way to go, Tina. Just give us a call and we'll get you set up to receive that deluxe hydrofacial. And so our grand prize, our hours next week, Dr. Baumberger, are
It's Thanksgiving.
right.
So we will be open Monday from 8 to 5. We will be open Tuesday from 8 till 2. And we'll be open Wednesday from 8 until 5. We'll be closed Thursday and Friday. We will reopen Monday. However, we will be running package specials and discounts on Botox if you buy it in quantities for at least the next week. We will be available till, Christmas for gift cards, for presents that you want to give that special someone. Again, you can always call. We can do live consults. We can also do Zoom consults. Depending on the area, we may have to bring you in, and we can do eClinical. We can do it through our medical software. We can do consults that way. But again, I want to emphasize that we're not going to charge you for the consults. That is just to gain information. That is just to get information to you so that you can make an informed decision and decide what you want to do and if you want to do something and what we think that you would need.
Yeah. And also we can set them up through Zoom as well. If Zoom is a better platform for them, also we have the Zoom platform we can use as well to do a virtual consult. And so in the grand prize tonight, I know we've got a double cool sculpting treatment in the grand prize. And also we've got several, actually an assortment of our skincare products from Revision to Abaji. And I believe we've also got a little bit of Botox left that we're going to have in the grand prize. Altogether, our grand prize has turned out to be well in excess of $1,000 that we initially advertised. So it's going to be a great grand prize. And do we have a winner for the grand prize, Dr. Baumberger?
She will be very, very happy because she has been on all night and has been so patient. Miss Lana Wuoluka.
Lana, can you spell that last name, please?
Wuoluka, Wuolukka.
Yes, she has been on all night. Congratulations, Lana. You're our grand prize winner. That is so awesome. You have qualified for cool sculpting, some Botox, and a whole assortment of skincare products. So congratulations once again, Lana.
With everything we offer, I want to make sure we cover everything.
So Dr. Baumberger, is there anything you'd like to say? Yep, we can hear you.
Sorry, I was asking Amber to get me something.
So is there anything you'd like to say to everybody tonight before we depart?
I wanted to check and make sure that we covered. Oh, we also offer Latisse, which is a wonderful gift, especially for someone like myself, who, as we age, our eyelashes tend to not grow as long, and it's a very simple procedure. We offer that, the pellets, the fillers, the weight loss. We also forgot to touch on dermaplaning, which is wonderful, and it's great to add to a lot of the other procedures because it removes the top layer of that vellus hair and the dead skin, and it prepares your skin for the procedure, as well as just doing it in and of itself because it helps makeup go on smoother and look cleaner and brighter. I think that covered it all. I just wanted to thank everybody who joined us tonight. We appreciate your time. We appreciate you being here. We really look forward to seeing you in person, or, talking to you one-on-one via Zoom or, televisit. We would love for you to come in, take a look at our facility, ask any questions you'd like to. And if you have any questions, again, our normal hours during the week are 8 to 5, Monday, Wednesday, and Thursday, and 8 to 2 on Tuesdays and Fridays. And again, I appreciate your time and your attention.
Yeah, and I just wanted to.
I think we ran a little bit late.
Yeah, we did run a little bit long tonight. It's our first stab at doing the virtual spa holiday party. But I wanted to thank everyone as well. We didn't have a chance to really touch on the HCG weight loss. We've got a lot of great updated content on HCG on our website, as well as all of our products. We're going to have that updated tomorrow as well. So you'll see a whole new fresh website tomorrow with updated products. And the next person that calls in for their consultation on a product or service that they have heard tonight is going to win a free facial. So first person to make the phone ring at 7:35 p.m. will get that free facial. Thank y'all, everyone. We appreciate your time, and we're going to leave on our video giving you a tour of our office here. Y'all have a great night.
Good night. Keep moving me all over the screen. Really? He took a picture of the bathroom.